Good afternoon. Dr. Fionnuala McHale here from Invigorate Clinic. So over the last few weeks we launched the Intravenous Nutritional Therapy side of the practice, and we've been performing the infusions at the clinic itself but also at the Irish Strength Institute in Artane. And so we've had a number of queries come through. So today I'd like to go through what exactly is in the infusions, who are they useful for, so who can benefit from them, and what exactly are the benefits of the infusions. So the most popular infusion would really be the multi-nutrient infusion, which is effectively a modified Myers cocktail. So what that includes is all of the B vitamins, some vitamin C, some calcium and magnesium. Now depending on the patient we might also give some vitamin D, depending on what we see on test reports. And similarly we'll also give some glutathione. So glutathione is one of the most powerful antioxidants in the body. It's excellent for helping the liver detoxify the variety of toxins that we were exposed to. It's also great for boosting the immune system and also good for enhancing recovery from athletic level exercise or training. And so what are the benefits of that cocktail? So who is it suitable for? Well, in general it's suitable for most people. We would particularly use it for people who might suffer from acute asthma, fatigue disorders, but also great for anyone with IBS or inflammatory bowel disease like Crohn's or ulcerative colitis. Similarly, I would see a lot of patients in my practice who would suffer from small intestinal bacterial overgrowth, some parasitic infections, candidiasis of the intestine, and generalized leaky gut, I guess, for anyone who would be familiar with that term. And those patients obviously struggle to get in a lot of nutrients because the lining of the gut is impaired. And so the intravenous route is particularly useful for those patients. We would also use it for, like I said, anyone with fatigue disorders, so someone who might have problems with their adrenal gland or cortisol, excess cortisol, low cortisol, and similarly for fibromyalgia, chronic fatigue syndrome. We would also use it for conditions like sinusitis, hay fever, and like I said, any upper respiratory tract infections, colds or flus. It's fantastic for accelerating recovery without the use of antibiotics or antiviral medication. So I suppose, why would we use the intravenous route as opposed to taking oral supplements? Another query that's come in over the last few days. And I suppose the intravenous route is ideal simply because the nutrients are not affected by stomach or intestinal disease or impairment of gut function. So like I said, anyone with leaky gut, impaired intestinal permeability, irritable bowel syndrome, which would account for 30 to 40% of my patients, inflammatory bowel disorders, Crohn's disease or ulcerative colitis. So the nutrients get directly to the cells, and because of the very high concentration gradient, it really forces those nutrients into the cells so that they can really have their effect almost immediately. And like some people will take a few days for them to receive the boost, but in general it works quite quickly. Similarly, I guess, compared to taking in a supplement through the mouth, we could give far higher doses than we would otherwise be able to give because of the intestinal irritation that one might experience from taking things like high dose vitamin C, for example, may cause some diarrhea, intestinal cramping, bloating, and similar with magnesium, which is a hugely essential nutrient for a variety of processes in the body. Giving high doses of magnesium can cause symptoms within the gastrointestinal tract. So I guess the other important point to note is that the intravenous infusions are not a replacement for a good diet, a good lifestyle, good exercise regime. They're there to complement that. So there's no point to take the infusion if you're not doing all of the other things as well. So I guess who are they suitable for? So they're suitable for all of the patients who might be suffering from chronic disease, as I described. It's not a miracle cure by any means, but it's something that can really give the patient a boost and enhance wellness in that patient. So we would also use it for anyone who's generally feeling run down, low energy states, and generally many people come who already live a very good lifestyle, who have a good diet, a good exercise regime, and really just want to boost that, to optimize health, to promote that sense of well-being. So I guess we would also use it, I guess, in the context of athletic performance. So we had a number of athletes in over the last few weeks, ranging from physique athletes, so fitness models, also to combat sport athletes like MMA, for example. And we've had some dramatic results in terms of their recovery from training, also how they feel. So a really good energy boost from the infusions. Many athletes would like to go for weekly treatments, 2 weekly treatments. Some people like to get them once a month. Particularly for athletes, for example, like the combat sport athletes, or weightlifting, powerlifting, anyone that might have to do a severe weight cut, works particularly well for those athletes who may be immune suppressed in the weeks leading up to the competition with the calorie and carbohydrate deficit, for example. And I guess what happens during the infusion? So what it is, it's the multi-nutrient infusion. We can give it over about 20 minutes. Some people can tolerate a higher infusion rate. Many of the athletes prefer the higher infusion rate because they get higher serum concentration of the nutrients and feel great after that. So I suppose, most common side effect from the infusion, some people may get irritation in the vein where the needle is inserted. But if that happens, what we really do is we dilute the cocktail the following time around. So the first infusion is really just getting a sense of the patient, how they like the infusion, do they like it faster, do they like it slower, and what kind of symptoms they experience during the infusion. So for example, some people get a very overwhelming sense of warmth, begins in the chest and some kind migrates further down the body, and some people really enjoy that experience. Other patients may find it overwhelming, in which case we just slow the infusion rate down. Obviously, anyone who's nervous with needles has the potential for what's called a vasovagal episode, but it's very rare, and we're very good with patients who may have a phobia of needles. So ultimately, I guess it's suitable for most patients. Obviously, we like to see you in the clinic for a consultation, just to go through your medical history, your medication history, what other supplements are you on. We may do some testing. So many of the patients, my existing patients in the practice, will already have had a nutritional workup, and in those cases we can actually tailor the cocktail for them. So we can change the doses of the nutrients that we give. So some people might need a higher dose of vitamin C, some might need more magnesium, and if we give a mixed trace element as well, we may give some from zinc, for example. Those doses can be tailored to the patient, which is nice. So if anyone has any other questions, please feel free to comment below, and I will be sure to get back to you during the week. During the week, we might also get a video up with a demonstration of one of the infusions, just so people can get an idea of what exactly it involves, so that you're more comfortable when you do come to the clinic for your infusion. All right, have a lovely day, and if I don't speak to you before Christmas, have a very happy Christmas and a lovely New Year. Bye-bye.